Dr. Lee, how do I know if a clinical trial is right for myself or my patient? And how would I know if a patient is eligible for a clinical trial?
That's a great question. Patients should discuss with their doctors on whether they should participate in a trial and how long they can safely wait to decide on a trial. I encourage patients to also discuss with any family or friends who they rely on for care and transportation, aspects of trial participation that they will need assistance with. Typically, requirements must be met for a person to be included in a clinical trial. These requirements help to make sure that participants in a trial are like each other in terms of specific factors such as age, stage of cancer, general health, and previous treatment. Inclusion criteria is a term that we use in clinical trials, and inclusion criteria are characteristics that the patients must have if they are to be included in the study. Inclusion criteria will vary by clinical trial, and specific examples of this are, again, age, stage of cancer, and previous treatments. In contrast, exclusion criteria are the characteristics that disqualify prospective participants from joining a study, such as characteristics that could potentially worsen the patient's health or outcomes if they were to participate in the study. You can enter a clinical trial anytime upon diagnosis or anytime during the course of the disease. There are several ways to find a clinical trial. First, you can ask your physician. Second, you can go online. All clinical trials conducted in the United States are required to register at clinicaltrials.gov. A more user-friendly site to search for clinical trials is emergingmed.com. You can view trials based on your diagnosis or answer a short questionnaire to narrow the search results to those trials that most closely match your needs. When someone enrolls in a trial, their treating physician is typically the first point of contact for trial-related questions or concerns. In some places, the clinical trial coordinator may also be a point of contact. People have the right to withdraw from a clinical trial, and if that should happen, the clinical trial must discontinue all future research-related activities with that patient, including giving treatment as part of the clinical trial, obtaining tests, and any additional patient-related information.